Should people have the option of buying insurance outside of their state?
Let me tell you why this is an important issue. If you don't have standards for health insurance, you're going to find that a lot of things you assume are covered are not covered. Written into Illinois law is a provision that I was part of as a young attorney down in Springfield. They were selling family coverage, maternity benefits that excluded coverage for newborn infants for the first 30 days of their lives. And you know what that means. A sick baby and all the expenses you have to pay for personally. So we put in Illinois law, if you want to sell a health insurance plan in Illinois with maternity benefits, you cover that baby from the moment it's born. That's in the law. Now, when you can jump from state to state and say, well, I'll go to the place that's the cheapest, you may end up with something that's worthless when you need coverage. What we're trying to do is to get to the point where every health insurance policy in America has basic coverage you can count on when you need it.
Dr. Lazarus?
Well, I think what we lose in the discussion is that many of you are concerned that you're either going to lose your insurance or you can't get your insurance. That if you lose your job, you're not going to be able to get it. You're not going to be able to take it from one job to another. If something like a public option, and we don't know what it is going to be, I mean, it might be different in the House, it might be different in the Senate. If that provides more choices and more pluralistic choices, we think that might be something that we should look at. But I think the big picture is to get everyone into the tent, covered so that they get the care that they need, so they don't lose it, they don't have to worry about bankruptcy if they have to pay high medical bills. And that's the big picture that I think we have to look at. The public option is just part of a very complex set of legislative proposals.
And yet some people think the public option is absolutely essential. Paul Fine, why do you think that?
Hi. First off, I'd like to say that I'm very glad to be at a place where we can actually have a civilized discussion about this issue without anybody screaming at each other. Secondly, I could ask you so many questions, but first off, the organization that you were referring to that came up with the Lewin Group, that's owned by United Healthcare. Secondly, healthcare is priced, talking about going across state lines, that's often a convenient thing that people are talking about, oh, well, if we only could buy across state lines. Healthcare is priced locally, like auto insurance and electricity. Buying across state lines would be impossible because the risk pools are local. Hospitals in Chicago charge different rates than they charge in Provo. And so anyone who tells you, oh, well, this whole business would be solved if we could only, you know, everybody in New York could go buy insurance in Provo, it's rubbish. It's just an excuse.
Why do you think a public option is essential?
Well, I think a public option is essential because it's a lifeboat. It is a basic plan that covers all Americans. And it basically goes to the basic premise. Do you believe that health care is a right or is a privilege? And if you believe it's a right, then everyone should be entitled to it. The beauty of Medicare is that it's applied equally. It's applied equally across the board. The elderly get one standard. They get one plan. And if they want to spend extra and they want to get an extra plan, they can buy that on their own or they can pay cash for whatever else they need. But it's a standard plan. And every civilized country in this world, aside from the United States, has a standard plan for people to go to. 20% of Americans are functionally illiterate. 50% of Americans cannot read an informed consent form. 25% of Americans have not graduated from high school. And the insurance companies love to say, oh, well, this will create competition, and people could go and pick and choose and read contracts the length of your arm. It's rubbish. It's just another smokescreen, and that's why I think a public option is essential.
Dr. Handel?
Yeah,